me again. Tuesday 13th of October. I can't remember what day we're into now. Not much has happened, so I was going to just go into how this all started really. Symptoms and whatnot. But I suppose if I'm honest with myself, I can trace this back 2.5 years. I've never really been one for sleeping through the night. Went to the doctors just after Isabella was born. She's what, 27 months now? Because I was getting up 4 or 5 times during the night. And doctor, we did the test for prostate cancer, that was negative. So doctor then said, I suspect it's an enlarged prostate. At which point I got a bit squeamish and didn't really want anybody sticking their finger up my bum. So said, okay, no problem. And so I just carried on. It never really got any better, progressively worse. And so by the end of it, probably getting up 6 or 7 times a night until on the, I can't remember what day it was, it was in June, 16th of June maybe, something like that. I'd done 10 quite big horses during the day, all of which had ragged me about a little bit, give me a bit of stress, grief, pulled me about. So I felt it, and from then for the next 24 hours I just bled. Every time I went to the toilet it was just blood. Then got referred 24 hours later. I rang 111. I think I said this yesterday. I rang 111. Sort of go into a bit more detail, and they sent me to A&E. A&E referred me to urology, blah 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 blah. Since then, I had the flexible cystoscope in urology. That was on the Thursday after the Sunday, so they saw me quite quickly then, only 4 days later. I wasn't actually expecting an examination. When you're told to go, you're going to go and see a consultant, you expect a consultation. And I was sitting in the waiting room by myself because it's coronavirus time, and just me in the waiting room. And another doctor came out and said, "Can you sign this consent form?" And I was like, well, "Consent form for what?" "I want to hear for a consultation." He said, no, just in case we have to do any procedures." So, yeah, okay, what procedure are we looking at? And he said, "Oh, flexible cystoscopy, look it up." And yeah, okay, I'll sign that just in case. He said, "Probably won't be happening today, but just in case, it's there, it's all signed for you, giving consent." So I then googled flexible cystoscopy, and if you Google it, it says something along the lines of a thin camera around the size of a pencil will be inserted through your penis into your bladder, and the doctor will be able to see what's going on inside your bladder. The camera itself and the tube itself will be coated with an anaesthetic gel which will numb the area as it goes up. So although it may be a bit uncomfortable, that will be all it will be. I walked into the consultation room, and there's a doctor there and a nurse, and the doctor basically says, "Right, trousers off, boxers off, up on the table." So it's a bit of a shock because I wasn't expecting it. "Right, we're going to do this cystoscopy, just lie there, blah blah blah." And he said, "If you want to watch it on the camera, just turn to your left and you can see it on the screen." Now, if I tell you, there was no way I could even open my eyes, let alone take in anything that was going on. That will probably won't even get you ready for the pain. I always thought myself as having quite a high pain threshold. I get kicked about by horses all day, you stamped on, you hit yourself with hammers. It's part of the job. So pain is just one of those things. That was the most uncomfortable thing I'd ever experienced, and I've broken my back, and I would rather break my back again than go through that flexible cystoscopy. I can't say the word. The flexible camera thing. he said, oh, that painful bit says it's passing you prostrate, after that it should be okay. It wasn't okay. He couldn't see anything, there was too much blood in there, so put me on antibiotics, and said we'll let you know. So I had another letter through that week, actually, that's quite quick, saying we're going to put you on the emergency operation list for the rigid cystoscopy, which is the same thing but with a rigid pipe going in, a bigger pipe that they can put tools and, I don't know, knives and forks and things up there, I suppose, but that has to be done in general. So the letter came through saying this will be done within, hopefully, I think it said 6 weeks. So from that day on, or from that Sunday when I originally went to A&E, I'd never stopped pissing blood. It was more of a shock if it was like a rosé colour than it was if it was pure blood. We had lots of clotting, not nice at all. It was difficult to predict. The clots were uncomfortable to start off with. They then got bigger and bigger to a point where they would probably, I suppose at the worst, I mean, it doesn't sound a lot, 2 tablespoons full of clots. Not that I measured it. I took to weeing in the sink, don't tell anybody, just to see the size of these things coming out. And they were not nice, they were big. And that didn't really stop. I rang urology quite regularly once the 6 weeks was up. I went for a CT scan in between these. And I think half the problem, I rang for the results of the CT scan, because they did their normal, if you don't hear from us, everything's okay. Rang for the results of the CT scan. Got through to the secretary, who said, yeah, there's nothing showing up on your CT scan. We'll probably just go in for an operation just to see how things are going. But don't worry. And I said then, look, I'm still passing blood, I'm still passing these clots. Is this normal? I'll go and speak to the consultant. She came back and said, yeah, you're on the list for the this emergency operation still, so we'll know more then. I think I probably rang them at least another 3 times. And just, I won't say I got fobbed off. I mean, it's COVID time, things are different. And it's, although I'm going through it, they see it all day, every day. I don't know if this is normal, I don't know what's going on. I'm thinking I perhaps ruptured something. That's where the bleeding is coming from. To me, there was too much blood for it to be a cancer, because cancers don't bleed, do they? So just carried on, and ended up, after being, I'm going to say fobbed off because I can't think of another word, not really getting anywhere with the hospital, ringing my own GP, explaining the situation, and basically saying to them, look, is this normal? Should I be, with the amount of blood I'm losing, because to me it was a lot of blood, should I be taking anything? Am I at risk of anemia or anything like that? Is there anything I can do? I just didn't know. He then rang the hospital, and the consultant then pushed it through, and I spoke to one of the specialist nurses there who rang me, and I said, can I send you photographs of what's going on? Because it's difficult to explain. I work in an industry where people exaggerate a lot. If they want to get something, they will. In their world it's true, but I deal a lot with lame horses, so it could be from an abscess in the foot, and they will literally ring up and say my horse is on 3 legs, which is fair enough, it happens with an abscess. So you go out, have a look, and I'll get there and say which leg we're looking at, and they'll say, well, I'm not really sure. Now that's an exaggeration to me, because if a horse is on 3 legs, it's quite obvious which leg it is. So they will exaggerate to try and get not to the front of the queue, but to get what they want to get me to go out, which is fair enough, I think we all do. So I was very aware and I'm very conscious that the nurses would have experienced the same thing. So I asked if I could email photographs of what I was producing all day, every day. And weirdly, they hadn't got a facility for this to be done, and especially in these times of coronavirus, when they don't want people there. To me, it was a no-brainer that there would be some email address or whatever that I could just send these to, and they could show the consultant and done. So they actually had to set up a an email address for me to send these things through. At that point though, they went, oh, okay, yeah, and I had the appointment then within 10 days, I think, for the surgery. And that was what happened with that. Post-surgery, I was talking about the surgery yesterday. Post-surgery, it was really good for probably a week, possibly 10 days. I think I bled a little bit for a couple of days after. If I had the operation on the Friday, I came out on the Saturday with clear urine, and that stayed. There's a few little clots and a few little discoloration I'd describe that. Probably until the Monday, and then it was clear then the rest of the week, or until Friday, Saturday. I haven't really kept track of time, and now then the blood has started to come back again. I'm now, what am I, 3 weeks post-op. I'm pretty much back to where I was before. The bleeding is pretty much constant. I've had a blockage this morning. Blockages are fun. This is the third time I've had a blockage, and what happens is, from a layman's point of view, I've not spoken to the consultant, you don't speak to very often. The clot just falls in the wrong place and must fall over whatever sphincter there is that allows your urine out and block it. So as hard as you push to try and get it through, nothing will come out. It's like really, really, really being desperate for a piss, but nothing comes out. It's horrible, and it gets to your head. It's sort of a panicky thing. And unfortunately, the only way to clear it is to flush it out. So you've got to drink lots and lots and lots of water, or tea, or Guinness, whatever, until the pressure behind it will push it out. But the more you drink, the more the pressure builds up, the more it hurts, the more panicky you get. It's not nice. And it's happened today. I've had to come home from work today. And it was unfortunately, I went to the first 2 horses, no problem at all. The third one I went to, I knew this blockage had started, but thought if I worked through the whole jostling about and stuff might clear it, because it does that sometimes. Sometimes it's just a clot that just needs to just jump about a bit and it clears. It wasn't clear. And I've been to a customer that I've done for a very, very long time. I think a lot of her. And we've been through a lot. I've seen her have 4 kids. She's seen me have 2 relationships, 2 kids, 3 grandchildren, 20 odd years I've been shooting a horse. So I had to tell her today what was going on, sort of with my condition. And it's weird that they're customers, but they're friends as well. That I've had to sort of, and it wasn't. She got upset, and it wasn't because she's got to find a new farrier. It was genuine worry for me, I think, and I think I'm going to have to go through a lot of that. Another customer had to ring this afternoon, who the horses are a job, so I felt it only fair to put her in the picture, to say, look, you might want to be looking for somebody else to do your horses now. And again, that lady I've done for, I'll lose track, probably 25 years or so. It's a long time to be with somebody when you're seeing them regularly, and it's a funny old job. I've said to people a long time, you don't have friends in this job, because you're only as good as the last job you do for them, and they will dump you at the earliest opportunity as soon as you do something wrong. But the loyalty is there, and it surprised me that both people today have been so sympathetic and genuinely concerned. That it's been touching, genuinely touching. Anyway, go back to the clot. That cleared. I went home with a lot of funny noises. I'm glad there was nobody there. I think of constipation, right, and the noises sometimes you make during constipation, and multiply it by 10. Again, that tube was not meant to have things go through, but it happens, and it comes out. And it'd be the third time now. It wasn't as panicky as the first time it happened. The first time I was on the point of calling 999. This time I was more sort of laid back and knowing that I would get through it. So that's clear. So I'm coming back out to work now. But I think these people have already heard what's going on. So again, it's going to be one of those. What's happening? Do we need to find a new farrier? And it's difficult at the minute until I get a staging next week. I've got a CT scan on Saturday, and they will then from that be able to tell me. I haven't talked about the CT scan. Wow, we can talk about CT scans. CT scan on Saturday, and from that next Wednesday they'll tell me the staging as to whether I'm going to be able to keep a bladder or not, basically. Whether it's just going to be chemo and then hopefully I might be able to carry on working, or whether it's going to be a complete operation where I may have to have at least 2 months off I may never come back from, and that's going to be hard to tell customers, but it's got to be done. So that's where we are today. It's been a hard day on 2 levels, emotionally and physically, but another day closer to a diagnosis, another day closer to the beginning of the end, I suppose, or the end of the beginning. I don't know where we are, but positive thoughts, looking forward to getting somewhere and knowing what's going to happen and knowing where the fight goes next. So yeah, speak to you soon.